culturally, there's some stuff that we go through that are sort of unspoken rules. Like we don't complain, we just show up, even if we just feel so tired and our sleep is unrefreshed, but we're not quite sure why that is. Maybe we wake up a lot. Oh, I just thought it was normal I had to get up and go. I've had a few kids. Maybe it's because I have to get up and run to the potty all the time. I wake up, I have this horrible headache, but women are more prone to migraines, so I guess this is just my migraine. I feel depressed, but maybe that's just my cycle. We can carry a lot of mental load as well as, honestly, physically, we can tolerate a lot. And we're taught that you put everybody else first and yourself second. So, all of those symptoms I'm describing, that could literally be sleep apnea, and we're busy thinking it's everything else but.
So, welcome everybody. We're going to be having a great discussion today about women and sleep apnea as part of our Sleep Apnea Squad series. So I'm Emma Cooksey. I'm going to be your host today. I'm the at Project Sleep. I'm the Sleep Apnea Program Manager. And I run the Sleep Apnea Squad series. So we try to address a lot of different topics that help people navigate life with sleep apnea. Today, again, our topic is women and sleep apnea, and we have a wonderful panel of just the best people I could think of to talk on this topic. As well as being the sleep apnea program manager here at Project Sleep, I'm also a patient advocate and a woman living with obstructive sleep apnea. So I went undiagnosed for about 10 years, and then I've been diagnosed and treated for about the last 18 years. So that's a little bit about me, but I'm going to have each of our panelists just go ahead and say a little bit about them, maybe where you are, your connection to this topic, and just I'd love to hear that. So Sabrina, did you want to go first?
I guess sure. My name is Sabrina Glazeris. I, excuse me, was diagnosed with sleep apnea probably about 15 or so years ago. And I started a Facebook group, as the little thing says. It's called Ladies Night Women's Sleep Apnea and CPAP Support. And that's kind of basically me. I am married with a cat and a dog, and I live in Omaha, Nebraska. Um, and yeah,
That's great.
that's basically the gist.
Thanks so much for joining us. I really appreciate
Yeah,
it.
thanks for having me.
Dr. Cole, did you want to go next?
Oh, sure. So, my name is Allison Kole. I am the creator and host of the Sleep is My Waking Passion podcast. So, I took a playbook. I took a page out of the playbook for Emma because she started her podcast too. And when I started this journey, it was really sort of a labor of love to talk about sleep. I have been treating sleep disorders really since the beginning even of my pulmonary fellowship. So now we're entering almost 20 years. And I'm particularly passionate about women's sleep because women have largely been ignored in research. We are often gaslit, not only in the work environment, as I have personally experienced, but also in the clinic environment as patients. It's very difficult for us to advocate for ourselves, but I think if we have the tools and the language, we're coming into our era. We really are. And the fact that you've invited me to be here today is a testament to that. So thank you very much for the opportunity.
My pleasure. Monica, did you want to say a few words about you?
Sure. And thanks for having me here today, Emma. So I'm the president and CEO of the Alliance of Sleep Apnea Partners. It's a patient-centered organization, and I've been in this role for about 3.5 years now. Just a little bit about me. Before coming here, I was a women's health advocate for over 15 years, and I'd worked in many disease areas. I'm a scientist by training, went into science policy for a few years, and then during that time, I got diagnosed with sleep apnea. So it kind of shifted my whole perspective. Not only was I felt like I was advocating for others, now I'm sort of turned around and advocating for myself along with others. So it took about, I think, I would say 5 years for me to get the diagnosis from at least from the time I was aware of my symptoms. But we'll talk more about that.
Yeah,
And so I live in Ellicott City, Maryland.
great. Thank you all so much for being here. I think it's going to be a really great discussion. So, a little disclaimer because we are talking about medical topics. So, this discussion is meant to provide information and resources, but it's not intended as medical advice. So, if you have questions about your own or a loved one's sleep health, or other medical questions, we really encourage you to speak to your own healthcare provider about those. But we hope that we can really give you, some great information and education around this topic. The other thing to note is after all of these discussions we have as part of our Sleep Apnea Squad series, we create a PDF toolkit, which is like a written, almost like a condensed version of like all the main learnings from our discussion. So we'll be putting that together, and as soon as that's available, a link to that will go here in YouTube under the video. There'll be a link to it. So just a little overview. So some of the things we're gonna be talking about today are patient perspectives. So our the three of our lived experiences as women navigating life with sleep apnea, but also as Dr. Kole touched on, just a little bit about what specifically women need to know about sleep apnea. So the signs of sleep apnea and how they can show up differently in women. And I also really want to make sure that women listening can find the community and support that they need. So we're going to talk a little bit about some resources that are available and sleep apnea community that they can get involved with to get the support they need. So without further ado, um, I thought we would just start off. I think, Monica, you kind of started talking a little bit more about your journey to diagnosis, but then you were like, we're going to get to it in a minute. So, did you want to just share with us a little bit about how you got your diagnosis? Like, what symptoms showed up to begin with for you? What stage of life you were in? Like, how old you were? Just give us some of that. That would be really helpful.
So looking back, I was always a mouth breather and I would always get breathless to the point like, my parents were aware, I was aware, always had a hard time running. So these were some of the signs that were always there. Fatigue was always present. Like I would get tired very easily, needed naps growing up. But again, we didn't think much about that, right? Until I hit my I think early 40s, and something started to change with regard to my health. And and it's a funny story how I got recognized the symptoms was I was actually hosting a roundtable discussion when I was at the Society for Women's Health Research on women and sleep, because we recognized back then, this was, I think, 2013, that not much focus was on women and sleep. So while during that discussion with physicians and researchers, I started to hear differences between men and women and the symptoms, and soon connected the dots and realized that I might have sleep apnea. So soon after that, I approached a sleep physician and asked if I could get diagnosed. And this was at Johns Hopkins, and I got diagnosed soon after that. So it was pretty quick, but like I said before then, when the symptoms started to appear, was I could say 5 years. But then again, like I said, some of the symptoms existed even before then. For me, once I got the diagnosis, I was able to connect the dots. Now, again, everybody's journey is different. For me, it made sense that I was able to now put a label on all these random symptoms I had, and one of them was um, I was pregnant with my second child in my early 40s. So I was like 41, and I had gestational diabetes. It came out of nowhere. I have no family history of diabetes. And I think that was sort of another one of those random things that, happened. So again, I can't say it was because of the sleep apnea, undiagnosed sleep apnea. But certainly once I started to get treated, I felt so much better. So I think that kind of, um, yeah, confirmed for me that there was something to all these symptoms.
Yeah, you're not the first person I've talked to who has been, in healthcare in some, in some sense that's kind of learned of it because they've been at a lecture and thought, oh, that might be me. So yeah, when I think I mentioned in the beginning, I went undiagnosed for about 10 years. And a lot of the symptoms that showed up for me, like one of the biggest things was anxiety and depression. I think sometimes that we kind of overlook mental health issues as being completely separate and not related to sleep, when actually there's a bidirectional relationship and one can make the other worse and all of that. So that was a really big thing for me. And I just definitely had a thing where I never felt refreshed when I woke up. And I had a lot of daytime sleepiness. So those were kind of some of the bigger things. I think a lot of women I talked to, um, I snored, but like I certainly didn't snore as loudly as some men might snore. So it's kind of one of those things where I think sometimes people are thinking, well, I can't have sleep apnea because I don't snore. But I think we'll get on to with Alison in a little bit about how sleep apnea can show up in women. But yeah, I agree with what you said about like I certainly once I got the diagnosis, and started treatment and got through the kind of adapting to CPAP and all of that, I definitely have enjoyed a better quality of life since
Mhm.
that. So that's kind of something for people to know. Sabrina, did you want to just share a little bit about your journey to diagnosis and what was happening with symptoms?
Sure. So mine wasn't as difficult as other stories I've heard. So I basically had my yearly checkup, and I mentioned that I was having fatigue issues. And my doctor at the time said that there was something about a push I think they were having at their office to test more people. I don't think it was specifically women, but just patients in general for sleep apnea. So they got me hooked up for an at-home sleep study. And it came back and said I had sleep apnea. So um, basically, that was kind of it. It was pretty
Yeah.
fast, and I got connected with a local supplier and got a machine and some masks and promptly just stopped using it.
Which is so common. So
Very
tell us
common.
more about that.
Yeah, so I used it for I tried using it for a few months, and I was able to sleep with it. I had a problem with it because I've got this like mole or beauty mark or whatever you call it right under my eye, and at the time they only had I'm also a mouth breather, so I had to have a full face mask. And at the time they only had the masks that were like triangle shaped, you know.
Yeah.
Mhm.
So obviously a nose mask or a nasal mask wasn't going to work for me. I had to have one a full face mask.
And this
And
was before the ones that went under the
yes,
nose. Yeah.
before those existed. And the little mole thingy or whatever it is would constantly break the seal and would blow air into my eye,
Mm.
which was irritating. And I already have dry eye problems with this eye specifically. And I couldn't take it anymore. And I was like, well, A, this is annoying, and B, I don't want to go blind. So I stopped using it for a while. And then a couple of years later, I don't remember if it was the same doctor, if I had started to see a new doctor. I think it was the same doctor. They pushed me to see a dentist, a specialized dentist that would make a mouth thing.
Mandibular
Uh,
advancement device. Yep.
yeah, an oral device. And I was like, okay, sure. I mean, that sounds better than wearing a CPAP. Let's try that. Um, and that was the whole rigmarole to get it, fitted and created, and I hated that worse. I mean, they say they meaning the people at the office said that like, oh yeah, 98% of people, you know, this works better for them than CPAP. They tolerate it better. And I was like, okay, well, I guess I'm in
Yeah,
that
I think
2%.
exactly. Somebody else just mentioned before how varied people's experience with sleep
Hmm.
apnea is, and I notice that all the time because my email inbox is just like I hate my CPAP, I love my
Hmm.
CPAP, I hate my oral appliance, I love my people have such
Yeah.
different experiences. I think it's really important to know that, and also
Yeah.
normalize that that's kind of part of it for a lot of people is
Mm-hmm.
trying different things. But then you did get back onto CPAP and
Right. So after the oral appliance didn't work, I was like, okay, well, this isn't going to work. I'll get I'll try a different mask. I'll see what else is out there. So I started Googling and I found that they had the under nose full face masks. And I thought, oh, well, that's so much better. I'll try one of those. I really didn't want to use the same supplier I had used before because I kind of felt like they were not helpful at all. So I found a new supplier that's local to me that's also in network with my insurance. And I contacted them and I said, hey, um, I have sleep apnea. I've got a machine already. Can I buy this specific mask from you? And they're like, yeah, sure. We just need an updated prescription from your doctor. And they said, who's your doctor? We'll contact them. And they did. And, um, everything was,
And it was
hunky dory.
better.
Everything was fine. And,
And then you became the Facebook,
yeah,
sleep
because
apnea
that,
queen, but we'll get to that.
well, yeah, that mask worked for me great. And
Yeah.
it's been more than 10 years and I've used it, consistently every night since, except for the one time I left my battery at my mother-in-law's house. So,
These things happen for
right.
sure.
Yeah,
Thank you so much for sharing that
sure.
whole experience. So Dr. Kole, I'm just wondering if you can kind of like go back and set the scene for us, because it always occurs to me during these discussions that we might want to just take it way back to like a little bit about what sleep apnea is. Just
Sure,
in
of
case there's
course.
people, like I know in our series, like we started out with a lot of introductory topics like that, but I'm aware that people dip in and out. So just maybe to talk a little bit about what sleep apnea is, and then specifically about what women need to look for in terms of symptoms that might show up differently for them compared to men. I mean, that's a huge
Sure.
topic, but
I think, by the way, just the fact that each one of you has your own iteration of what happened, culminating in Sabrina basically revealing that, hey, if we focus on it, we can make a dent. So I just want to start by saying you've highlighted something really important, which is you're giving the rest of us sleep providers that are trying to spread the word about the importance of screening, especially in the primary care environment where most people are going to be seen by someone that, you know, if you build it, they will come. I know the road was so difficult for you, but the fact that your physician was even willing to be like, hey, we're really kind of looking at sleep apnea newly and kind of prioritizing it. It's very simple to get these sleep studies done, especially nowadays. So that's just a really good point. And it makes me feel good that advocacy is working. I think you're an
Yeah.
example of that. So we still have a long way to go. I'm not saying things
Mhm.
are perfect, but I'm going to say amen to that.
yeah.
So, why do we even care about sleep apnea? What the heck is it, right? So, obstructive sleep apnea, there are different kinds of sleep apnea, but the focus of this discussion is going to be what's most common. What do most people present with? And that's going to be obstruction of our airway. So, if we really think about what's happening, I'm a pulmonologist by training. So I'm going to nerd out a little bit, right? So one of the ways that we distinguish what's in the chest versus what's outside of the chest is this little part over here, our sternal notch. That's sort of like our, thoracic inlet, if you will. So if you're looking at anything that we talk about, I'm talking about anything that's outside of the chest cavity. So up here. And so we have our nose. And for some people, we can breathe better through our nose than not. And then we go further back. And that's ideal is if we can be a nasal breather, which, as we know, Sabrina, you've highlighted the fact that some people can't breathe well through their nose and they end up being a mouth breather. That automatically kind of increases your upper airway resistance, makes it more likely that your airway is going to close off. But in essence, what happens is we have all these muscles. We've got our tongue muscle and all these other little muscles that we take for granted because we're speaking and we're talking. We're not even thinking about our airway because we're breathing okay. And then when we relax and go to sleep, those muscles also relax. And they relax to different degrees depending on what stage of sleep you're in. But ultimately, in the situation of obstruction or obstructive sleep apnea, it means the muscles have relaxed to the point where they've either collapsed either completely, so you're kind of breathing against an airway that's closed, or near completely where there's still flow. But what we know ultimately, right, is in order for us to get the proper oxygen in our bodies, we need to have an airway. And when we go to sleep and our airway closes off, and then we can't breathe. What happens is our body goes, oh, we need to wake up. So there's these little tiny wake ups. Most of the time, we're not even aware of how frequently they're happening because we're sleeping. But we're having these little tiny wake ups, and that's repeatedly happening hour by hour by hour. And that's ultimately what sleep apnea is. When it happens and it's happening more than 5 times an hour, we got a situation. And that is really what we're looking for when we look at kind of defining what it is. That's the very base level criteria.
I would love for you to keep going and just talk a bit about how you see sleep apnea showing up in women specifically and especially for people watching, like what they should be aware of and what they should be looking for in themselves and their loved ones.
So when we think of women, right, it has been historically in the context of, well, how do men look? So men, the classic stereotype of sleep apnea is there for a reason. And that's because everybody just thought it was a man being poked by his wife. Oh, you're snoring. So they're snoring really loud. Maybe their wife thinks they stop breathing. Maybe they'll actually wake up and then they'll fall back to sleep. They may be sleeping every which way. They get home from work. They're laying back in their recliner and they're out like a light until their wife tells them it's dinner time. I mean, we're talking really, really stereotypical stuff.
Mhm.
And then you get to women, and all of you have shared some of your experiences of just having, yes, you can still be just as sleepy, but maybe you're snoring. You may have heard of it as like, I'm purring like a little kitten. It's not too bad. My husband doesn't really complain about it too much. The snoring can be subtle. Or maybe you don't snore at all. Or at least you're not willing to admit it because maybe that feels embarrassing to you because it's not cool for a woman to be snoring, right? So there's a little bit of like what we're taught about what's acceptable and sexy in a lady versus not that I think does play a role here that I just want to point out because
Yeah.
culturally, there's some stuff that we go through that are sort of unspoken rules. Like we don't complain, we just show up. Even if we just feel so tired and our sleep is unrefreshed, but we're not quite sure why that is. Maybe we wake up a lot. Oh, I just thought it was normal I had to get up and go. I've had a few kids. Maybe it's because I have to get up and run to the potty all the time. I wake up, I have this horrible headache, but women are more prone to migraines. So I guess this is just my migraines that I've been suffering with for years. Um, those are just some of the real, you mentioned mood changes. I want to highlight that. Oh, I feel, I just feel like I'm kind of anxious and it's hard for me to really feel like I can relax and get good sleep. I feel depressed, but maybe that's just my cycle. Maybe it's just because I have a lot of responsibility because I'm working. But I also have to take care of the family. I get these crazy nightmares. I have these weird, vivid dreams. I just thought that was part of whatever, my childhood trauma that I haven't processed or what have you. I have this pain, my joints ache all the time. These are some of the symptoms. And the reason I'm phrasing it the way I am is to highlight the fact that we gaslight ourselves so much. And when you talk to the provider, one of the things that we do as women is we tend to go, well, I feel this way, but it's really not that bad because ultimately we are women and we are incredibly strong and resilient. That's why we're the ones that have the babies and not the men. We deal with a lot of stuff. Our society kind of says you're still going to be mommy, but you also can be a powerful woman who works. So we can carry a lot of mental load as well as honestly, physically, we can tolerate a lot. And we're taught that you put everybody else first and yourself second. So all of those symptoms I'm describing, that could literally be sleep apnea, and we're busy thinking it's everything else but. How could it possibly be sleep apnea? And that's the point of this conversation is say, no, look, we can present in a much muddier fashion. It can be a lot harder for us to tease out what's going on. And so I think that's where I would say in terms of the symptoms, but I wanted to point out just one more thing that I think if there's any providers who are logging on here and listening, or anyone who wants to go to talk to their sleep provider, one of the things that we know about us as ladies is that on paper, I mentioned that, hey, how many times do you stop breathing per hour? We might have a relatively low number. And if somebody comes at you and says, hey, well, it just looks like you have a little bit of mild sleep apnea, more can meet the eye for women because our airways tend to not necessarily collapse completely, but we can still have really crappy disrupted sleep, even though our number per hour may look low. there can be more than meets the eye for women. And especially with our just how we're built and our lungs and the traction that we have smaller lungs than men. That can play a role. We tend to have what we call REM-related sleep apnea. That means during rapid eye movement sleep, when our bodies are literally, all of us, men and women, our bodies are paralyzed, our muscles are paralyzed. We're very actively dreaming, speaking about vivid dreams. Um, and we can have things go much worse during that stage of sleep. But if you look at the whole number throughout the entire evening, it may look little.
Mhm.
So we can tend to present with a mild degree of sleep apnea that often is overlooked as it can't be that bad. It's just 5 events per hour. And so that's another trick that
Yeah.
even, people on my side and myself included, like I had um, a real epiphany treating so many patients who have mild sleep apnea because I realized it's not just about a number on a page. I mean, we're so data obsessed in this culture. Like, what's
Yeah.
my Apple Watch saying? And,
Yeah.
what are the tools saying? In the end,
I,
it's how you feel,
I
you
think
know?
sometimes people get confused when I say like mild sleep apnea, but not necessarily mild symptoms. So mild sleep apnea meaning like the number of events on the test. But I talk to women all the time with really pretty severe symptoms. So yeah, I guess it depends on your own body's reaction to those, events and what's happening with the rest of your sleep. But yeah, I love that. I'm really glad you raised that.
Can
Um,
I say something, Emma? Like, I
yeah,
agree
go
with
for it.
Allison there. I always say that numbers don't mean anything to women. I mean, really, because it's really the symptoms and it's individualized, right? It's again, to what degree. If you're fine, you have sleep apnea, you're not showing any symptoms, it's not disrupting your life in any way or your sleep quality, and you're able to function, then that's fine. But if it's starting to really interrupt what you like to do or your sleep quality and you are not rested, then of course then it's a concern, right? So yeah, numbers don't mean anything, and I think it's how the woman feels. And Allison, you mentioned you forgot to mention insomnia. There's a lot of confusion there, where a lot of primary care physicians also think it's insomnia, or women think it's insomnia. That thought of sleep apnea never crosses their mind.
The other thing I love that Alison mentioned was just this idea of sleep apnea as being thought of as a male condition and the sort of shame and stigma that surrounds it. Like I know I've shared this story before, but I really didn't know anything about sleep apnea when I first got the diagnosis. And when I was trying to adapt to CPAP in the beginning, I found it quite challenging. And I went to like a cookout in my neighborhood and I was chatting away to like one of the other dads at the kid's birthday party. And he kind of was just asking me how I was getting on and what was new with me. And I said, "Oh, I actually, I started using the CPAP mask at night because I had this thing called sleep apnea." And, kind of like just like thought, well, that's the main thing happening with me this week. And he looked at me and kind of laughed and he was like, "Isn't that something that big old truckers have? I've never heard of a woman having sleep apnea." And that sort of throwaway comment was enough for me to feel so much like kind of embarrassment and shame about being a woman with this diagnosis that I really didn't talk to anyone outside my immediate family for years. Like even when I started doing patient advocacy stuff, I had so many friends that were just like, I didn't know you had sleep apnea before I'm like, telling the world all about it. But like, I think that that's pretty common. Is there anything, I know that Monica and Sabrina, you got diagnosed a little bit later, which I think sometimes makes a difference. But did you have any of those feelings of like, this isn't the most feminine thing, or you just wanted to go ahead and get it treated and didn't care?
Sabrina, you want to go first?
Um, I didn't really have a problem with it. I was already married by the time I got diagnosed. I mean, I know a lot of folks, a lot of gals in my Facebook group are younger and single, and they sometimes have issues like, when do I bring this up to a new guy I'm dating or gal I'm dating, and do I bring it over? Do I bring the machine over, on a date, or how do I introduce this? So luckily, for me, I didn't have that. Um, but um, eh, yeah, I personally haven't had those kinds of issues. It didn't really bother me so much. So I guess I've
That's
been
good.
lucky in that respect.
Yeah. What about you, Monica?
It didn't bother me as such, but already I was working in a field where I was
Right.
advocating for sex and gender
Yeah.
differences.
Yeah.
And once I found it, I'm like, great, there's another condition now women have been ignored. So I think it made me more mad than
Mhm.
Yeah.
than ever, because again, I had worked in so many other disease areas, cardiovascular, musculoskeletal, or just a couple of them. Pain was one area where women are often ignored. And all of a
Yeah.
sudden, it's just like, what? Nobody has even bothered to study, sleep apnea in women. So,
Yeah.
and I think that's where this passion for advocacy and coming into sleep apnea came about. Like, I
Mhm.
feel like we are so far behind compared to some of those other disease areas, which again, I have to say that has taken a long time. It's 20 plus years for us to now recognize that symptoms of heart disease are different in men and women. I
Mhm.
mean, it's now common knowledge, right? And then women die more often of heart disease than breast cancer. But then it's going to take us time, but we have to constantly do. And again, what you're doing, Emma, we're talking about the topic. We have to just continue to do that. And like you said, your experience, what somebody said that to you. Yes, it was a disservice. That's how, in fact, the condition got even recognized, right?
Yeah.
When, with big men who were having trouble breathing. But
Yeah.
that's all changing now,
Yeah.
that's all changing. And we just have to continue to bring awareness to this
So I think
condition.
one of the things that we talk about all the time at Project Sleep is just the need to advocate for yourself in medical settings. I think exactly what Alison said about the way that women tend to talk about symptoms. I think the way you described it was so perfect. But I think it's kind of getting over this idea that in order to get the referral you need, like you have to, like unfortunately in this area, sometimes you just have to go in kind of prepared with what you want to say. So I thought that Alison, you can maybe talk a little bit about a lot of people out there don't realize that there's such a thing as a board certified sleep specialist. I
Mm.
think for the 10 years that I went undiagnosed, if I had known I could ask for a referral, I could say, I have these signs and symptoms, and I've noticed that some of these could be sleep apnea. Can I be referred to a board certified sleep specialist? I think that would have been so helpful for me because I think I did a lot of what you were talking about. Like, well, this, but I don't think it's, anything. And yeah, exactly. So if you could just share a little bit about board certified sleep specialists in general and what they do, that would be really helpful.
So I was just having a conversation with why am I having a total brain fart now? Dr. Feinberg,
Yeah.
Fariha Abbasi Feinberg, who's going to
Yes.
be the president-elect of like
Yes.
the board
Of
of
the
directors.
American Academy
That
of
is who the
Medicine.
person is that I had a brain fart on.
Yes.
Okay. So that's not embarrassing, not at all. But what she was commenting on is like not even until it was like I didn't realize this, but it was like the early 2000s before sleep was even recognized as being
Yeah.
its own subspecialty, right?
Yeah.
That's mind-boggling.
Yeah.
And so a lot of people came, one of the things to look for is that you're going to probably have someone who has a background that's going to be outside of sleep, and then sleep is the subspecialty within that. So
Yep.
just so to level set, we have family practice folks. On rare occasion, you might even have a psychiatry background person. Neurology is quite common. Pulmonary critical care, like myself, is
Yep.
common. Internal medicine is common. So we often come with this background of experience, and then we have a subspecialty in sleep. And since 2011, it is required that we do a sleep medicine fellowship, and that is 1 year long before you can sit for the boards. You are going to meet older doctors, particularly if they were allowed to grandfather in. As a pulmonary critical care specialist, I can tell you there are many people who are board certified, but they did not necessarily do the sleep fellowship. I think that matters if you're talking about sleep disorders outside of obstructive sleep apnea. It's great that we have more providers that can provide care for obstructive sleep apnea, but we have one of the special things about actually doing the sleep fellowship. And I can attest to somebody who did a lot of sleep care as a pulmonologist in the OSA clinic at the VA, at the West LA VA. is that we learned about narcolepsy and these other types of rare disorders. We learned about how to care for insomnia patients more efficiently and with gold standard therapy. We you kind of run the gamut of different sleep disorders. So there are other things that may cause you to have really crappy sleep, and sometimes you have sleep apnea. Plus, you got some of these other things going on. And so, looking for that board certified sleep specialist, it's going to be someone who says, I have a board certification, either an ABMS or, there's going to be a diplomat. And the website on the American Academy of Sleep Medicine will host a whole slew of these are the folks that are actually board certified in that specialty. It really does make a difference. And I would definitely look for somebody who, has that sleep medicine fellowship certification if they're available to you. This is not pooing the people that came before me,
Right.
but there is something uniquely special about having that sleep education. You spend an entire year doing nothing but sleep, reading sleep studies, etc.
Yeah.
So I hope that clarifies it a
That
bit.
does. That's super helpful. So we're going to switch gears a little bit. So when I first got my diagnosis in 2008, I find myself kind of troubleshooting various issues I was having with my CPAP. I didn't have a lot of support, which I know a lot of people can relate to that. So back in 2008, it was pretty much me in the middle of the night typing questions into like forums and like, why is this happening? And people saying, why don't you have a humidifier? And I was like, what's a humidifier? Like really basic stuff. And I noticed at that point that most of the people on those forums were men. So I'm coming to you, Sabrina, just to kind of ask about like your experience and where this idea for starting a women only Facebook support group like came from, and just if you can tell us a little bit about that.
Sure. So basically, it was somewhat similar. I was in different forums, and most of the people there were men. And not that that was a bad thing. I mean,
Right.
I've learned a lot. I just kind of felt that, women had a different experience, as far as like we've brought up the medical gaslighting, just the different, mask shapes and sizes. I remember one of my first masks was, it was called For Her, and it was slightly smaller and pink. And I don't know if it really was for her other than those things. And I have a big head, so I don't think it even really fit right, even the large one. Um, and I think that there are some things that women will really only talk about with other women. Um, you know, some things that they might say, well, this is just a vanity thing, because they've got lines on their faces when they wake up, or, you know, I never knew about using nipple cream on your face if you've got like sores and stuff. And I'm pretty sure most women won't bring up nipple cream in front of a guy,
Right.
or in a forum. I certainly never saw that recommended in any of the other forums that are, mixed gender. So that's kind of why I wanted to start it, just to have a girls only kind of place where you could talk about it and discuss it, because it's not, just men that get it. Um, it's, women get it too, and I just felt like there was a void, and certainly, again, not to knock the other forums that are out there. There's certainly great resources. I just kind of felt like there was something missing, and that maybe, you know I could fill that and, help out. And I had a couple of friends who had sleep apnea, so I was like, hey,
So
do you
then
think
it
this would
grew
be?
into more than a couple of friends.
Yeah, then it like exploded. Like it took a while to take off, but then it just
Mhm.
like exploded out of nowhere. So yeah, and now I think
Yeah.
Facebook actually recommends it to people. So that's kind of
Yeah, I
scary.
really appreciate how well moderated your Facebook group is. Like
Yeah, we
just
try.
because there's so many out there, and it just, especially because you're talking about a medical thing, I think you guys
Hmm.
do a really good job of, just like sticking to good information and referring people back to their
Right.
doctors when you need to. So
Yeah.
yeah, it's really
Yeah,
good.
we try, and it's myself and my two moderators, and we try to keep people on topic. We try not to let, people, be mean to others, which is
Yeah.
can be
It's
difficult
really
online.
supportive, which I think is really key.
Right. That's
Yeah.
what we try. And then we have we had a spate a while ago of several posts trying of people trying to sell, like snake oil cures, and we had to put
Yeah.
the kibosh on that. I mean, I'm all for alternative treatments. If something works for you, it works for you. That's great. I'm all for discussing alternative treatments. You know,
Especially if they're FDA approved.
well, even if they aren't FDA approved, if something works for you, it works for you.
Right.
That's great. But if you're only there to sell your snake oil,
Right.
we're,
Yeah.
that's not
That's
cool.
not the
We're not
purpose of
doing that.
your group, right?
And
Totally get that.
I won't say the words I use, but the elephant stuff
So I wanted to
cures. We don't
really
allow that.
so there's a resource, Monica, that you worked on a while ago about women in sleep apnea, which is like a PDF with it's like a two-sided thing with one side for women talking about symptoms to notice and the other side for healthcare providers. Do you want to tell us a little bit about where that came from, like what the discussion? Because I still send people to that a bunch
Oh
because I
yeah,
think it's
no,
really
that's a
helpful.
fantastic resource, and we created
Yeah,
that 10 years ago, um, when I was focused on the women and sleep. Because again, after my diagnosis and after all the several conversations with like, we need a resource for women for sleep apnea. So the way we designed that was so something that Allison was saying, even about primary care. The whole goal was to focus on self advocacy because now for me it was easy because of my insurance. I could directly go to a sleep specialist, but there are a lot of people who can't. You have to go through their primary care, right? And that's where the bottleneck is. And sometimes women can go to the primary care, but the primary care is not in primary care doctor is not informed and may dismiss the woman saying, oh no, you don't have sleep apnea, you may have anxiety or depression. So with keeping that in mind, we were like, well, let's provide this toolkit to women so they can identify the symptoms that they have and take it to their doctor as a conversation starter and say, hey, listen, I checked off these symptoms. I think I might have sleep apnea. And then, so that's the front side, explaining that to women. And on the back side is information for the healthcare providers for them to then review and say, okay, the women have checked off this, and then this is what you can do now, and have them recommend them to a sleep specialist. And also in there, we mentioned you can order a home sleep test because a lot of primary care providers won't know about the home sleep test. So, and again, for women, if the home sleep test comes out negative, you still send them for a sleep, to a sleep study. So that's the kind of information we have in that toolkit. And I've personally had women come up to me and said, hey, I didn't even realize I had sleep apnea and I used this toolkit and now I got diagnosed. So
Mhm.
it's been very, very helpful. It's really worked well. And yeah, so that's really the genesis of, why we got
Yeah.
started. But it's
That's great.
really, I
Thanks for
mean, very
sharing about
helpful.
that.
Yeah.
This discussion I know could be 4 hours long, so I'm going to try and. So, I wonder, Allison, do you want to just pick up a little bit on that about, I think oftentimes people don't realize that home tests particularly can rule in sleep apnea, but can't necessarily rule it out. And I hear from a lot of people who are like, well, I had the home test, but it's negative for sleep apnea, but they still have significant symptoms. So, do you want to maybe address that and just that people can then go and, ask for an in-lab study?
Yes, and I think what you're bringing up is such a critical point because I see it all the time. I do a
Mhm.
combination of in-person and a lot of telemedicine at this point in my career. And I can say that it is a discussion that I have every single time that I'm in front
Yeah,
of a patient and we're about to order a test is this level of education. People are being advertised, well, the likelihood that they're missing it is only like 2%. It must be good.
which is not
Depends on the pretest probability. So, where are
right.
you? What are your symptoms? Again, getting back to the symptoms, especially for us ladies, and what individual test are you using? Not all the tests are the same,
Right.
and kind of depending, you're really more accurately, especially because women, remember, typically have a lower AHI, they're more mild.
Yes.
So you have a higher likelihood of potentially even missing the woman in that situation. But that person who checks off all the obvious stereotypical boxes, your accuracy is probably closer to maybe 90% of the time, and you might be missing about 10% of those cases. And that is in the obvious situation. If you have the more subtle symptoms, and again, we're expecting that maybe your AHI is not going to be as high, there
Right.
is a lot more wiggle room for error than meets the eye. So don't be fooled. So that's the limitation of a home sleep apnea test. It's great, it's convenient. What makes it more accurate, though not necessarily covered by insurance, but if you're open-minded, you can get multi-night testing. So if you have multiple
Yes.
days where we're seeing that we don't really have a ton of sleep apnea, what I have found, because again, I'm a purist and I believe just because I see multiple days, I have had people in my concierge practice where we are doing a little bit more intricate longitudinal testing that when I put them in the lab, the results end up being similar for them. So that's where I think the multi-night testing, and there's data and publications that have supported this, could be more accurate in home sleep apnea testing. That being said, the gold standard still remains what we call the polysomnogram. So anybody
Mhm.
listening, you may hear that, but really what that represents is a test where you go to a sleep lab. There is a technician there. They're going to hook you up to the wires. They're going to be looking at your sleep architecture, meaning the stages of sleep you're going in and out of, what's going on with your airway, even the more subtle events that are really important in women, especially. They're going to be able to tell you this is what's going on when you hit rapid eye movement sleep. This is what's going on when you're not in rapid eye movement sleep. This is exactly how much sleep you're getting. These home tests are really estimating sleep according to a
Right.
very specific, unique algorithm per the individual device. So that's really the difference there.
And then the next thing, that was a really helpful explanation. The next thing that we really don't have time to get into is I really wanted you to just kind of go over a little bit about the different stages of a woman's life and how sleep apnea can be more prevalent among pregnant women and women like during and after menopause. Um, Really briefly, so my journey with sleep apnea kind of happened that my diagnosis took place after the birth of my first child, but before I had my second child. So I had the unique experience of, having really pretty debilitating symptoms that got worse during pregnancy. And then, feeling just really bad during that pregnancy. And then, getting CPAP in between and then having another pregnancy being treated for sleep apnea and noticing the difference between the two of them. And it was like night and day. It was so much better with treatment. So it's something that I feel really strongly that women in pregnancy should be screened more. But if you could just kind of like lightly touch on that, that also
In
is
a
a really big
in a
topic.
nutshell, yeah, no, in a nutshell, when you're premenopausal, we've got all our hormones, estrogen, progesterone. Those actually help to stabilize the upper airway. So that's one of the reasons we see less sleep apnea when you're younger. When you go through pregnancy, there's just a lot of fluid shifts. So we kind of, we're creating another human in our belly. So that means we got more blood volume and all these other things. We tend to swell up a little bit more. The fluid's got to go somewhere when we sleep at night. And so it may increase our risk to have our airway close off for that reason. And then if you're already starting, we have a lot of we're heavier than we used to be in the past. So if you've got weight on you and you're kind of going into that pregnancy, maybe in the obesity category already, that might also kind of increase your risk that might be one of the flags to actually see if you should be screened for sleep apnea even earlier in that pregnancy. And if you ever develop snoring along that pathway, um, definitely look into whether or not you have sleep apnea, just because it means you're at higher risk for gestational diabetes or preeclampsia, some of these bad things that may be bad for baby and for you, potentially making that pregnancy more challenging from the health perspective. And then as we essentially think about it, as we get later in life and perimenopause, our hormones are like this, and then you get into menopause and everything kind of goes down, all of that shift basically lends itself to a lot of sleep disruption. And Monica, you're very correct. A lot of more insomnia tends to pick up, but sometimes that's also when our hormones are less protective of our airway, and we're going to see a precipitous increase in the risk of sleep apnea for women later in life, especially as we perimenopause and then menopause. We sort of meet men where they are at kind of throughout their lives for that reason.
Because it's not funny at all, but like looking back, it just makes me like cringe a little bit how many doctors were saying, "Well, you're just pregnant though, So people just don't sleep as well when they're pregnant without really looking into could it be sleep apnea? And then similarly during menopause, I hear from a lot of women who are told, sleep disruptions are a really normal part of menopause. And without really digging in and testing when they have significant symptoms. So yeah, just something to be aware of for people. Did anybody have anything else before I do my slides to wrap up?
I'm going to do a
Just
shameless plug. I did interview Dr. Gada Borgelli. She
Oh,
is really well known in the pregnancy and obstructive sleep apnea space. She's out of Brown University, and she is actively looking to recruit women, specifically women of color, to participate in her study because this is an untapped resource, guys. We don't know what we don't know, and she's
yeah,
trying to shed light on the health disparities that women of color especially go through. So,
yeah.
if you're interested, please reach out to Brown University, take a look, because if you're pregnant and you suspect you might have OSA, this would be a really great way for you to participate. She is not looking to give you any intervention. She's really looking to explore what your journey through pregnancy is like, and you could be helping out your fellow man.
That's a wonderful plug. I love that. Sabrina and Monica, did you have any last words?
Yeah, I just want to add, Emma, that, we're launched 2 years ago. We launched Sleep Apnea Education Week because
Oh,
I realized
that
there was
was
no
that was on my
day
list,
week or
Monica, and I
anything.
didn't get to it. So yes, tell us about
That
the Alliance of Sleep Apnea
Yeah,
Partners.
so that was a surprise. Yeah, that was a surprise to me coming in. I'm like, it's one of the most common sleep disorders, yet there's no day, week, nothing,
Yeah,
dedicated to it. So 2 years ago, we launched Sleep Apnea Education Week with the goal to promote awareness and education around sleep apnea. And so
yeah,
this year we'll be going into a third year. And thank you for being a fantastic partner, Emma, with
yeah.
Project Sleep, being engaged in this as well. So yeah, and I think the goal is, and the campaign did well, and we're just going to continue to, try and raise more awareness and
Yeah.
education around sleep
Thank you for
apnea. And so,
reminding me and for all the work you've done with that because that was
yeah,
on my list and I blatantly didn't get to it. So,
no, totally fine.
Sabrina, do you want to just share a little bit about
Oh,
your
Emma, let me
Facebook?
just share the dates quickly so the
Oh,
people
I
are
think
aware.
that this video is going to be going
It's
out
the
during that week, but go ahead
Yeah,
and
so
share the
it's
date.
April 18th to the 26th, and it's a social media campaign, and everybody is welcome to come join in on the campaign. We have toolkit and graphics available on our website, so apneapartners.org, and anybody can download those, craft your own messages. And our tagline is Make Sleep Apnea a National Priority, which means it needs the same level of attention as other chronic diseases, like heart disease or diabetes. And that's why we chose the tagline to raise national awareness on sleep apnea.
I love that. Thank you for all your work. So, Sabrina, I just wondered if you want to share about your Facebook group in case people want to join.
Sure. So it's called Ladies Night, NIGHT, just like, if you're going out to the bar. You could probably search Facebook for it and find it, no problem. Um, and yeah, we allow women, any women. We do not allow guys. Don't try to join, we won't take you. But yeah, if you have sleep apnea or if you have are a caregiver of somebody with sleep apnea, we would take you. We're happy to have people, and we, discuss any kind of sleep apnea or sleep issue thing. You don't have to be using a CPAP machine. If you're using an oral appliance or some other thing, that's also welcome in the
Yeah,
group. And I would just say in general for anyone starting this journey or in the middle of it, just keep going. Just progress over perfection, and nobody got it
yeah,
right the first night, and
yeah.
just
And
keep
get the
plugging along.
support that's out there to help
Yep.
you.
Just keep swimming, like
So
Dory
thank
says.
you all three of you for being like the dream panel for this topic. We're going to compile a thorough list of resources for the PDF guide that I was talking about earlier on. But I just thought that these were some great resources that were relevant to our three guests. So Sabrina's Facebook group again is Ladies Night Women's Sleep Apnea and CPAP Support. The PDF that I was talking about that Monica has is linked on the Alliance of Sleep Apnea Partners website. So it's apneapartners.org and it's called Women and Sleep Apnea PDF. And then also just a shout out to Dr. Cole's podcast, Sleep is My Waking Passion. She has a lot of really great interviews with a ton of different people talking specifically about women and speaking about sleep apnea. So I definitely recommend you check out a whole bunch of those episodes. I've just listed, so these are kind of the three main patient advocacy groups in the US. So Monica's group, the Alliance of Sleep Apnea Partners, ASAP for short, and then Project Sleep, obviously. And then a couple of people have asked me and were a bit confused. So the American Sleep Apnea Association has sort of transformed into the Wellness Sleep and Circadian Network. So they do still have some sleep apnea resources. So if people are interested to check that out. And I'll list, there are a lot of international groups which we'll list in our toolkit that we'll make after this. So yeah, just our campaign is ongoing. So sleep apnea, let's face it. We're particularly highlighting this campaign during Sleep Apnea Education Week, like we talked about, Monica talked about a little bit. And so if you want to get involved with this, you can print our sign, take a photo, and post on social media about it. So our goal really is to shatter stereotypes and showcase the real faces of people living with sleep apnea. So that's that. And then just to let everybody know, we do have a national sleep helpline at Project Sleep. It's free to call. And all we're doing is trying to offer navigational support with this. So oftentimes, like we came up a lot in our discussion, people don't know like quite where to go with their particular questions. So we have people that can offer you support and also talk through what the next steps might look like. Oh, and then for anybody watching who is a private donor, we really appreciate all your help. We couldn't do our work without you. We also want to say a really big thank you to our corporate partners, ApneaMed, Axum, Lilly, and ResMed. We definitely couldn't do our work without you, and we really appreciate it. And mostly, thank you all of you for watching. So like I was saying, our PDF toolkit will be linked below this video when it's available. And the best way to kind of keep up with what we're doing at Project Sleep and the Sleep Apnea Squad and all the things I do is to sign up for e-updates. So there's a link at project-sleep.com. You can do that. I'm doing a monthly Zoom call for sleep apnea support, which is not only for women. So if you're specifically interested in support only for women, then it's not for you because it's open to anybody. But I would say we've had lots of women since I started. So that's every month, and the next one will be May the 10th, on Sunday, May the 10th at 3 p.m. Eastern. Everybody's welcome. It's free, but you do need to register ahead of time. So the best way to get linked in with that is to sign up for the e-updates as well. And I just want to say a really big thank you to everybody, and we'll see you next time.